go ahead and jump in. We are recording this for those who aren't able to join. We will be sharing the recording and following up with the action items that we're going to begin tackling today as we kick this off. So welcome everyone. I am Shauna McGuckin. I'm here at the Family Resource Center Association. With me here today is Patty Velasquez and Mandy Waterscale, here with the Colorado Family Resource Center Association. We're in Colorado, so we're 2 hours ahead of you all. We're in the middle of our days. I will kick this off by asking a question to you all. On the agenda that we sent out in preparation for this meeting, we had originally scheduled this meeting to be 3 hours. When I pulled up the Zoom calendar invite, literally like 15 minutes ago, I realized that on your calendar, it's probably just held for 2 hours. So that was, I'll take the total ownership on that. But I wanted to ask you all just to come off mute and let me know, and we'll just do this by kind of what the majority here is. If you have time to meet today from 9 to noon, or if you're planning and needing to end at 11.
I have time until noon today.
Same, and mine shows till noon on my calendar, so I don't know. Yeah.
Okay. Well, we have lots to go through in the next 3 hours. So if you all are willing and able to stick it out for those 3 hours, we are excited to kick this off and really dive into things. So that's good to hear.
And Shauna, I'm hearing that your sound is kind of coming in and out. I don't know if that's just me. Is anyone else having that? Yeah. You might need to use a headset.
Okay. All right. Well, as I'm doing that, Mandy, then I may stop sharing mine here.
Oh, you can, I think you can share the screen still if you want to like maybe play with your audio. I can do the next slide if you want to play with that for a minute.
That would be great.
Okay. So while Shauna's figuring that out, I thought we might just go ahead and start with really simple introductions, your name, your title and role, and the organization you're with. So Shauna already introduced me, but I'll introduce myself again. I'm Mandy Waterscale. I am the co-executive director for the Family Resource Center Association here in Colorado. And I'll hand it off to Patty, one of our other staff members.
Good morning, everyone. Patty Velasquez, Implementation Director here with the Family Resource Center Association. And I'll be getting to work with you all once we get into the program side of things and helping you all replicate our service delivery model and our tools and supports that we have. So very excited to be here and just kind of introduce to you all who I am. So, and then looking forward to working with you all. So excited to be here.
Do you want to pick somebody, Patty?
Yeah, I'm going to pick Abby.
Hi, everyone. Good morning. Abby here. I live in Soldotna. I have a small consultant business, so I have several contracts across both statewide and locally here. Mostly in the upstream prevention field, and have a background just I've built out some statewide networks as well as like a local alliance here in Soldotna, and that's a hat that I wear called SAFER, South Central Alliance for Family Resilience. So I have a background convening, and I understand the importance of partnership and strengthening those partnerships. In all of this work, we have to do that, especially here in Alaska and how unique it is. So I have accepted this consultant opportunity to lead and help build and scale the network here in our state, and I'm really excited about it. So I can't remember what else was on there, sorry, but I'm Abby. Good to see everyone. Happy Friday. I will go ahead and pass it to Roselle.
Good morning, everybody. I am Roselle Busby. I'm a program manager with Alaska Behavioral Health. My role focuses on training, both internally, clinical trainings for our staff, as well as for outside providers across the states. A lot of it's around just evidence-based practices for like trauma treatment, and I do a lot of outreach within that role as well. So happy to be here. Sorry, I'm going to bounce it to.
Oh, it might have cut off who you picked, Roselle. Sorry.
Sorry, I just seen Kristen. So.
Hi, everyone. Good morning and happy Friday. My name is Kristen Bierma, and I'm the Executive Director of Beacon Hill, which is a private organization here in Alaska that serves Alaska's children in foster care and families at risk. So we have staff across the state, and we have 2 family support centers, one in Anchorage and one in Matsu Valley, that we are looking at expanding to become resource centers. So we're excited to expand the programming that we're already offering to families. And shout out to Colorado. I lived there for 7 years as a child, and my in-laws still live there, so it's close to home and love going back to visit. Yes, love all the sun that you have. I will pick Emma.
Good morning, everyone. My name is Emma Sullivan. I'm VBNA Children's Services Division Manager. So I oversee all of the tribal child welfare workers in the Bristol Bay region and in Anchorage. I also oversee our prevention programming and anything really child welfare, child safety related in our region. So I'm happy to be here. I'm located in Anchorage, but I'm back and forth between here and Dillingham. And I am from Colorado, so I also love Colorado. I haven't been there in a while, but that's where I grew up. So thank you, guys. Oh, and then Paul, I think you're the only one who hasn't gone.
Morning, everyone. I'm sorry I was late. We were slowed down by a moose in the road this morning that didn't quite make it across the road. So I know. So I am Paul Cornells. I'm the Executive Director at Alaska Youth and Family Network, and we're resource centers for families from across the state who are raising children with mental health or substance use, experiencing substance use issues, or their parents. The primary population that we serve are families that are involved with child welfare, or families who have children coming into Anchorage for mental health treatment from outside the road system. And I am really happy to be here this morning.
I think Charity, you might be our last one to go.
Hi, Charity Carmody. I facilitate the Alaska Impact Alliance, which you all know is a group of child welfare practitioners across Alaska, or those who are family serving entities. And we're working on collaborative prevention projects. Yeah, glad to have you all here. Glad to be here.
Great. And Shauna, I don't think you officially get to like mention your name too. So.
I just jumped in. Can you hear me better? Okay, am I echoing? Okay, good. I just have to wear these now for the next 3 hours. I'm Shauna McGuckin here in Denver, Colorado with the Family Resource Center Association. My role is membership manager, so I support our member network across Colorado. We have 33 members, and also part of my role is working throughout the country now on supporting other entities interested in becoming and building out a family resource center, or sharing what we have learned over our 25 years of building out our statewide network. So we're excited today to share some things going on in Colorado, and as you all think about what that can look like there in Alaska, and very excited to be here as we kick off our service model delivery there and spreading that across the country and into Alaska, which is exciting. So glad that you all were able to carve out this time today. So, Charity, next, before Mandy and I kind of take the reins here today and go through our agenda, I didn't know if you wanted to kind of say anything as kicking us off here. I know you've been really instrumental in pulling everyone together before Mandy and I kind of jump into all of this.
Sure. I just wanted, and for most of you, this is something you've heard a zillion times now, but I wanted to kind of recap where we're at, how the Alaska Network is starting, and what our vision is for it carrying forward. Abby, who already introduced herself, is going to take the leadership of the network, but to give a little context of the Alaska Impact Alliance's role in this and your role, and then also for those who will watch the recording later, because we do have some newer people to the conversation that maybe weren't there from the beginning. So as one of the things the Alaska Impact Alliance wanted to work on was these community-based preventions. Like, how do we actually arm communities to serve their families? And FRCs obviously are very successful across the United States. And so we looked at this model and said, we think that this will work in Alaska, and we think existing agencies that already are there could just build out capacity into what they're, like many of you already, you're here to do that, to build on to that. And one of the things that Alaska hasn't done particularly well is standards of service delivery, standards of organization, and across multiple entities, because we have a complex system of tribal sovereignty, state sovereignty, as well as like a lot of agency driven work. And we're a very spread out state. And so in coming to creating an Alaska network, one of the key things that was really important to building was that we develop and adopt standards so that we know what's working, what isn't working in our community, so that we can work on true scalability and find a way to evaluate, which is also something that's been missing across Alaska in a lot of ways, like true evaluation from especially like larger programs like this. And so in doing this, we contacted the National Family Support Network to become a member of that so that we could know kind of best practices and how other states were doing it, and became a member. But then we were like, okay, we need to create this Alaska network. What will this be? Who will be the members? Who will help us through this? Which is why we got involved with Colorado, you all, and the Mental Health Trust graciously paid for all of this. So to put it in a nutshell, the reason that we're doing this is so that we can create a true network of support for our FRCs that are going to launch in Alaska. And we have, essentially, we have 2 school districts that are already undergoing the process of doing their FRCs, but we have 2 to 3 more that are very interested in the next couple of years of launching FRCs. And then we have, anywhere from 8 to 10 agencies, private agencies that actually want to do FRCs. So we have a lot of interest across the state. And each of those FRCs, of course, will look different, but we wanted to create true supports for those leaders to implement, and so that nobody feels like they're doing it alone, so that we can give them the resources needed, and so that then we can go back to the state of Alaska leaders at both the OCS level and the legislative level and say, these are working, or here's where to invest. Here's, instead of maybe making recommendations that haven't been vetted out yet. And so we wanted to build in evaluations. So there's a couple key ways that we want to do that with this network, which are really important to get at the ground level. One of those is that every FRC operating as a member of the Alaska network is going to have to adopt the national standards of assessment and training and evaluation. And we are particularly adopting the evidence-based model that Colorado is using for actual family assessment. And this is really the first time that there has been kind of this requirement for a standardized family assessment. And it's a great assessment tool, and it's a way for us to help families actually see kind of their progress. And it's a way for us to help our folks working with families to see progress and to know how to take that case to the next level. It's a way for families to, and you'll see from Colorado's model that there's a way for families to adopt different ways they want to engage. Not everybody has to do everything, but they can decide which things they want to participate in. But really, it's a way for us to capture data too, to go like, okay, this, you know, people are falling off here. Everybody says they want this, and we consistently don't have that offered, or we're not finding that the issues of poverty are really being dealt with. And how do we look at that as a state? And how do we then affect policy and action? And so the standard of assessment and evaluation is a big deal, and we want to offer that to our member FRCs, either at no charge or very limited charge. We really do want to raise the money as the AIA to fund that, so that it's not cost prohibitive for entities that want to do the good work. So everything from the training, and we went and got our own Alaska trainer certified to offer standards training. And the other thing that's going to come with this, along with the assessments that Colorado is going to provide us, and the organizational structure. So Colorado is going to actually help us build the network, but it's also going to go hand in hand and coach all of our FRC leaders in best practices for FRC management. Everything from, you know, we're going to together create the bylaws and all those other things, but down to processes and protocol of the best practices of FRCs. And then in addition, we have the funding to build out a multi-user referral database system and collection system, which we are going to, in Alaska, take Help Me Grow's statewide referral database system and resource system, and build that out and connect Matsu. It's the same system. Build it out to be multi-user. Right now, it's just connect Matsu and Help Me Grow kind of utilizing that, and then one other small, links, I think, using that. But we are going to build it out so that every FRC every member FRC in Alaska is going to have access and be able to use that same referral database and capture all the data for the families they're serving. So, and it will be built with all sorts of security like locks inside of it. It's through Salesforce, but we're using a vendor that has successfully created these multi-user databases in FRC networks like California and others, so that you as an FRC, individual FRC, can enter in family data and the assessment tools and all those other things, but then no other FRC will be able to see that, and another agency won't be able to see the specific sensitive information about a family. But we will be able to pull demographic information and like what families are actually utilizing, and we'll be able to build in some code. So you as a group will be responsible for what kind of data do we want to collect as a state? Do we want to know? One of the main things we are interested in is how are we reducing the amount of protective services reports that need to go into OCS? How are education outcomes being affected? These are the type of things that you as a group are going to decide what is gathered. So we have the funding already to build out that system, which is significant, and we have the vendor already in place. And so that's going to be built as soon as the 501c3 status in Alaska for the Alaska Impact Alliance comes through. And then in addition to that, we are working with, I have already gotten a tentative bid from the Omni Institute, who is the evaluation firm for this Colorado network, and also many other FRC networks, as well as the National Family Support Network. They're the ones that conducted the research for Casey Family on FRC efficacy and all of that. We've already talked with Omni, and they have given us a bid to basically evaluate the Alaska network from the very beginning. How do we launch? How do we scale? How do our tribal partners do this in a culturally appropriate way? How do those of us, those who are operating agencies that are not necessarily tribal partners, like how do they do it? How do we scale in Alaska in a very different environment than a lot of FRC networks? And so Omni wants to come alongside and basically track all that and provide the research, and then help us evaluate the efficacy of our FRCs at year 1, at year 2, at year 3, and so that we have that. So as a member FRC, you're going to be able to know what's working in our programming, what, our families said they wanted this, but maybe that's not really the thing they're utilizing, or, you'll be able to tell all that, which is, I think these kind of supports are what agencies need in Alaska. They really need to somebody to say like, hey, don't just like, it would be good if you evaluate that, but rather we're going to provide the evaluator, and everybody's going to get that as a benefit. And you know, we're going to give you the database, and we're going to give you the training, and then we're going to provide those supports. And in addition, we're going to provide an environment where this leadership team can come together and say, what's working, what's not working, how do we want to make this stronger? We're having people that want to start FRCs, and what tools do we give them? Really to create kind of a robust system. That's our goal of FRCs that can be stood up. And we realize that these things take time. We won't know how this is working for a few years, but we have to start somewhere, and we have to start in a way that provides us the information to actually know. We're not, if we just haphazard start something, which is what we're not going to do. And clearly, you know, Mental Health Trust is paying Colorado to actually bring us along in this process. So we're not having to reinvent things. We're not having to go figure it out on our own. We can use tried and true methods, and then watch it along the way and adapt and change as needed quickly with what we're doing. So I think it's a really exciting project for sure. I think it's going to be a very large project across Alaska because we do have a lot of interested partners. I think we have people that want to fund it. Casey Family will probably be the one I'm hoping that will fund the Omni evaluation element of this. If not, we have other people that are interested. So we have people that are really vested in seeing this Alaska FRC network succeed. And you, as people that have come to the table as leaders, are going to be making all the decisions for how this plays out. And so your ownership and your buy-in and your voice in this is at a critical time in history, honestly, for Alaska to take that next step towards a more robust and strategic way of launching a large network. There aren't a lot of these kind of networks in Alaska. So this is a very strategic, and we're hoping to just kind of keep it that strategic and keep it informed by you all and you deciding and taking ownership of this within your communities. So hopefully that all made sense, but I just wanted to make sure everybody's kind of aware of our approach going forward and what we want to do with this information when we gather, and what we want to do to support you as member FRCs.
Great, thank you. I'm totally excited, and I'm not in Alaska, so. All right, so we are going to jump in and show you kind of how we are going to begin all of that work today, knowing that today is the kickoff for this leadership group, and knowing that we're not going to be able to tackle everything that the leadership group needs to decide on today, but doing a lot of level setting, a lot of understanding what's been done, what the benefits of a state network are, and we're going to begin doing that today, knowing that this is going to take time, but we have good direction for that. So today we will show you the value of a state network for family resource centers. We'll go into some detail here in Colorado and what that looks like. Some of you may have seen some of the presentations before and leading up to this, but some of you have not. So we really wanted to spend some time and share what some state networks look like around the country, and the evaluation and model that is used here in Colorado that you all will be using. Patty, I know, has to jump off at a certain point, so we want to make sure that she has enough time to share a little bit about the model today too. So, so I think Patty can stay on for up until the break, or does have to hop off at some point. So she'll share a little bit about the model. We'll go into our meeting outcomes with activity. We do want to make this as interactive as possible and not just have heads talking here on the Zoom meeting, but get your input. So we'll do some work and activities, and do want your participation throughout all of this. We will take a break halfway through, stretch your legs. This is a long time to be on a virtual meeting, we realize. Some action steps of taking away today we need to, because this is a new leadership group and decisions do have to be made to move forward. At the beginning of your work together, we need to decide how decisions will be made with this leadership group. So that's an action item that we want to take away today, knowing what that decision making process will be. We really are going to spend some time after that going into the roles of the leadership team, the strengths, and the talents of this leadership team, and to really understand who's here, who we can really be leaning on, what all of our strengths and things that we bring to the table are. And then also understanding the difference between your role here as a leadership team and your role in your local community, whether that's your role over behavioral health in Alaska, and how that may be different than your leadership role here in the network, and how that is a strength as well. And then we will assign you homework. It won't be a huge lift, but we will spend some time wrapping up for the last 20 minutes of this, with some overview of purpose statements and planning for the next session. So we'll see what we all can get through in this next 3 hours. I do want this to be as interactive as possible. So please do stop, come off mute, interrupt Mandy, myself, that's fine. If maybe your question is, oh, we're going to get to that in the next 20 minutes, or no, let's address this now, please do know this is a small group, which actually makes it easier. So please just come off mute. This is your time to learn from one another. I put up some meeting agreements here on the screen, thinking about how kind of just, again, level setting of how we want to interact with one another. So please do put your camera on if you do have the internet capability to do that, because we do want this to be as interactive as possible, and to get your input. The more we learn about each other and hear from one another, I think the easier it is to take action when there are action items that this leadership group needs to make. So please do interact, ask questions, share experiences, share concerns, but do all of that with that solution-focused mindset, with that growth mindset of we're all learning together. And though we might not have a solution today, it's a solution that this leadership group I know can take on. So some boxes I put up here is to share your experiences, because you're all coming from different experiences, life experiences, as well as different organizations. Brainstorm stumbling blocks, again, kind of having that growth mindset. We are going to have some time to develop those peer-to-peer connections in this agenda, and come off mute and share. Use those active listening skills, and really our goal is for this to be a safe space, to learn and develop this exciting work. And if you have other things to put back on that screen that you'd want to highlight, that, you know, the meeting agreements can grow. So those are just the beginning.
So just to kind of get us kicked off here, we like to recognize, obviously this is a first meeting that we have together, so we don't know each other really well yet. Some of you might know each other really well, but as a group, we don't know each other in the same way. And so just like to start with this kind of level setting of like, how are you showing up today for this meeting? So this doesn't just mean professionally, but can also just mean, how are you showing up as a person, right? So when we come to meetings, it's not always with, I'm Mandy as the co-ED. I'm also Mandy, you know, mom, wife, daughter. I've got a lot of other hats that I wear in my life too that affect how I'm coming to this space today. So I think it's just important to take a minute to allow everybody to quickly go around and maybe share what's on your mind or what's on your heart. So what's on your mind might be, I can just start as an example. After hearing Charity give that kind of kickoff, I'm really excited for you guys, and I'm really excited to be able to partner with you on this work, because I think one of the things I really like, I've been with FRCA for 14 years, and it's really nice to know that we can maybe share what we've learned with other folks, so that you don't have to take the 25 years it's taken for us to get where we are. And hopefully we can make that a lot quicker for you. And it's just a really exciting time for you, kind of at this jumping off point. So I'm feeling excited. That's what's on my mind. What's on my heart is it's Friday, and I am really ready for this weekend. I think we were talking about at the beginning, this was spring break for me with my kids. So have been trying to sprinkle in doing some fun activities in between needing to get work activities done. And so I'm really looking forward to having some unstructured, unscheduled time this weekend. So I'll just hand it back, and maybe in the same order that we did at the beginning, if you remember it. So I'll hand it to you, Patty. And you can share both if you want. If you have nothing to share, you can pass too. That's fine.
Thank you, Mandy. What's on my mind? I think, again, similar to what Mandy mentioned, hearing, Charity, kind of where you guys are visioning this work to be able to go. It's really exciting. I know me and you had a lot of conversations before we got this work done. We worked on that grant together to try to get the funds for it. So seeing it to where we are now, kicking off this work is just really exciting. And, it's just a lot of excitement. And then we're, I think, working with Shauna and Mandy, typically I work with states on the programmatic side, and I'm very excited that we're bringing in kind of that organizational and building an FRC to get, all lumped into one project, which is very exciting. And then what's on my heart, I have a lot of going on in my personal life right now. Birthdays are coming up, and it's going to be a crazy April month. So I'm trying to find some kind of relaxing time to just make a plan of how I think even for this project, right, like how are we going to plan it out to make sure that we meet all of your needs and meet all of those deliverables, but also help you move that work forward. So I'm trying to do that also in my life. I need to put a plan in place that lays out what I need to get done to make sure that we have very successful birthday parties coming up in the next month, as well as some other events that are happening. So yeah, and I believe the next person was Abby.
Yeah. Okay. So on my mind is racing. Every time I listen to you explain this, Charity, I just somehow, although I've heard it several times, I learn new things and I think about things differently. So I really appreciated just that intro, and it just made my mind race. And so I feel like I need to listen back to it and take more notes. But so I'm just really excited about that. I think just how much that inspires like thought and creative thinking in general about how we can connect and build this is exciting to me. And then on my heart, I will say I graduated college, went into corporate America, had like the comfort of the benefits and all the things. And so taking this leap of faith to move back home, the Kenai Peninsula, and work for myself essentially as a consultant was scary, but I did it because I wanted to be able to choose projects and work that mean something to me, create sort of like a legacy for my children that are growing up here and others. And so this is such an honor to be part of. And I feel just chilled to be part of this, because I truly do believe it's the start of a really important, impactful, and long-term change here in our state. And so I have 3 daughters, Tess, Lila, and Livy, and I just feel so thankful to be able to do this work and hopefully impact them and their futures here. So, and many others. So that is what is on my heart today. So I'll pass it over to Roselle.
Thank you. That was beautifully said. So I think in my head, and to be honest, so like I'm about a big role that I do at the agency is plan a huge conference that's launching registration in a week. And I think any meeting going on is like, I just feel kind of pulled in several directions, because I have about 1,000 small tasks to do before we launch registration in a week. So I honestly a little bit distracted in my head. But my heart is, just as Abby said, just listening to Charity and like getting great minds together with so much experience and like on mission is really exciting and inspiring. And I don't know if my agency will ever have a FRC. That's why I'm here, because I'm trying to like push the dial forward that one day that will come to fruition. But I just kind of think like, what would that look like a year from now, 2 years from now, 3 years from now, like having different FRCs both embedded in my agency, but just popping up around the state and what that could do for our kids. And it's awesome.
I think I was next. I just have to say, Roselle, I've been to your conference and it's amazing, and it will be amazing again, and it will all get done. And if you need any support in the meantime, let me know, because I know it's a million things. So what's on my mind today is, our organization Beacon Hill has experienced some recent growth, and which is really exciting. So we've restructured some things and gotten creative about space, because we have kind of a small building to fit it all in. And so with that comes some growing pains. And so that's been on my mind this week. Just, how to grow well and adapt, help staff adapt to change, and change is hard. So that's been on my mind. What's on my heart is, let's see. Well, I have 3 young adult children, and my youngest graduates from high school in 2 months, and my oldest gets married, and my middle child is studying abroad in Spain. So my heart is pulled in these seasons of lament and joy during this. I'm like, did you have to do it all at one time? Really, children, how rude. All these major milestones. So it's all exciting things and super proud of them, but it's a lot in 3 months. So that's on my heart. But I am really excited to be here. So Dawn Paulson is speaking of change, she just became our family support director. So she's now over all of our family support centers. So she will be the one probably moving forward to be a part of this group. She's just out of state this weekend looking at colleges with her son. So she's amazing. You'll love her. And she is excited to be a part of this work as well.
And I think, was I next? I'm sorry if I'm cutting someone off. I think kind of like, I don't remember if it was Roselle was saying, managing a regional child welfare situation is, there's always a lot of things going on. So I am like here, but I'm also seeing emails come in that I'm concerned about. And we have, deadlines for grants and legal deadlines for appeals and just different things that are all happening at the same time. So dealing with rolling deadlines, we also in April have a very busy month. We have NICWA, we have tribal state compacting negotiations, we have board meetings, we have trainings, just all kinds of different things that are going on. And so this is kind of my like last week before last week where I am in control of my time for a week. So managing that is an adventure, but I am so excited about this. I think that's what's on my heart. Resource centers are best practice. And so I am eager to see more of them in Alaska. I think, opportunities for families in general, especially in more rural regions, is a struggle. And so being able to centralize that would make folks' lives a lot easier, particularly in like hub cities, where if they're coming in, they can meet more than one need at a time. I think that would make a tremendous difference for a lot of our families that are involved with this system. So I am so excited about this and so grateful to be here with you all. I think Paul was next.
Yeah, I was next. So I think what's on my mind is a little bit of what all of you already expressed. And I think I have for a while now been thinking about how exciting it is that there's a possibility that AYFN can expand its reach to a place where when I first came on here, we had AYFN was in most of the hub communities and a lot of the smaller ones, and just over the years with resources. And I think the other thing that's exciting to me is just being a part of this group, and so many really brilliant people thinking about how to move the needle forward on family support. I think that I'm really excited to be a part of that for sure. And what's on my heart is my family was COVID really impacted us a lot, pretty hard, and things seem to be settling down now. And I'm not quite trusting it, so I'm saying a lot of prayers that we're moving past all the things that we've been working through, and I'm going to be able to focus on whatever's coming next. Thank you.
Thanks. I think I may be bringing up, am I the last?
I think Charity is next.
Charity's next. Okay.
Like you, my mind is a little distracted. This is one of many projects that I feel like the AIA is tackling. And so I'm glad Abby's going to take the helm, because it feels a little daunting to me to do this and the other things that are on the agenda. And in my heart, I'm a little, I'm just really hoping it works, honestly. I'm just hoping that, like, we get, you know, enough buy-in from actual agency leaders, and that people feel like they can. Alaska is an extremely independent-minded place, and it's often hard for people to agree to do things in a true with a model. Like, we don't do models very well, and so I'm hoping this can be a way that we do a model that's adaptive enough and relevant enough and effective enough to create a little bit of a shift there, do a little nudge to Alaska to work on some of these things in a more collaborative way and find processes for that. So I'm just, honestly, I just feel like I'm crossing my fingers and hoping that people are willing to take a shot at it and not dismiss it right away, because that often can happen. So that's where I'm at with it.
Okay. I'll share that on my mind is really hoping that the structure for this next 2.5 hours is going to land well with this group, because this is new. It's a new group for Mandy and myself to facilitate. So that's on my mind, just, you know, getting through Friday afternoon here. And then on my heart, excited that my brother from the East Coast decided at the last minute to fly in and ski. So I get to see him this weekend. So, yeah. So looking forward to, again, maybe that's on my heart too, that the way that this is facilitated and that we have enough time for dialogue today and really hearing your voices, that we have balanced this well for this morning for you all.
Thank you. Thanks everybody for participating in that. You know, hearing a lot of common themes, you know, for everyone, in particular, the excitement for one thing, but also a lot of folks feeling overextended right now and distracted with a lot of other things on their plate, but also really looking forward to the successful launch of this, because it might really move the needle for families in Alaska. So thank you for sharing that. And just would invite you, as much as you can, maybe just take this time to just do this if you can, you know, and not have to check your email throughout, and save it for the break. And maybe maybe this is a chance for you to give your brain a little break, because you are doing something productive, and that's going to be hopefully really impactful for your state. So thank you for participating in that. So why are we here today? This is kind of big picture outcomes we have for today's meeting. So we really want to develop trust and connections with each other, we hope that we have a common understanding of what a state family resource center network can be, or how that might be able to fit in for Alaska. Establish some roles of the leadership team and then the local agencies who might become the family resource centers. And then also hope that we can kind of agree on a decision-making process for this group going forward, because that'll help us be able to make decisions at the later meetings. So those are big picture what we're hoping to do today, and we'll check back in on that at the end. And with that, I think I'm going to hand it off to Shauna here.
Yeah, I'm trying
I will say this first part, I apologize, is going to be a little bit more of us talking, a little bit less interactive, but I'm really big on context. I think it helps us understand later why maybe we're doing some of the things we're doing. So this is just a little bit of going to be more of us, unfortunately, talking at you. But please feel free to ask questions as they might come to you. You can use the chat, you can raise your hand, you can just come off mute. And then Patty, I'll just also add, if you at any point want to chime in for the programmatic side, please feel free to do that.
Yeah, I was going to add, because I do need to hop off, but I know that the model process or the program model side we might not have time to cover it today, and that's, I think, okay. So I just want to take this opportunity before I cut you guys off in the middle of your flow, but so yeah, so I'll be the one kind of working with you all when we kind of get to that time of like, now let's start thinking about how we can start bringing some of those centers who are ready, or those organizations that are kind of ready to begin doing our service delivery model and starting using the tool, or start, kind of walking you guys through that process, because it will take some time as well. And it might happen kind of simultaneously as you're continuing to work with Mandy and Shauna doing this more of the network building an FRC side of the work. So we'll be in touch. And again, Mandy, Shauna, and I are working together on the behind the curtains to make sure that the timing works for you all, that when I start beginning to work with some of you and hopefully some of your sites that are going to be doing this work, we have it kind of all timed for you all in the correct way, or the best way possible that we can, because it is a lot, as you all know. When I think there's a slide today's deck that they'll talk about what that is. What is the model that we're talking about that we're going to be implementing? And then, of course, it's going to be a brief overview, because then we'll really dive into once we get into that work. But I wanted to just be here for this kickoff, introduce myself so you all know who I am. I know I've met several of you already, but I wanted to just take the opportunity to be here and then let Shauna and Mandy do their thing around how do we begin this work, this project with you all, which again is very high level setting, and really setting the stage for having a successful project with you all. So, and then I'll hop in. I'll start kind of working either with some of you or with a different group. Again, that's all of the process that we'll begin to sort out and think through of who that group is that I'll be working with. And so just very excited, but I'll hop off. And then if there's any questions, I know Shauna and Mandy will give me, will let me know what you all landed on, and then we'll take it from there. So
thanks, Patty.
all right, thank you, everyone. We'll see you guys.
All right, now I'm going to kick it off to Shauna.
Okay. So we thought, like Mandy said, we do some level setting, share a little bit about the Colorado network, and talk a little bit about the model that you all will be using that we developed here and what that looks like in Colorado. So as we're thinking through, you can think now, how applicable is this to Alaska? Just start getting your mind around what this would mean for Alaska, because we will start to unfold all of those questions with this leadership group. Not that we'll address everything today, but we'll start in that direction. So as you're listening, just have your mind going with questions. And we'll start chipping away at all of that. So a little bit about the Family Resource Center Association. We here in Colorado are a state intermediary nonprofit organization. We have our own board and family resource centers that are doing the work out in the community. They are either their own nonprofit with their own board, or a few of them are embedded in school districts, like Charity said, a few there in Alaska are embedded in school systems. So currently, statewide in Colorado, we have 33 members across our state. We don't have family resource centers in every nook and cranny, as you can see on this map of Colorado, but these are the entities that are following our model, are following our fidelity to the supports that we provide with the standard trainings, with access to a lot of the supports that Family Resource Center Association provides. Our mission statement is that we are committed to strengthening families through partnership and collaboration. We've been at this for a while now, and now we are working with more and more state entities interested in using our model, using the outcome and evaluation tools that we've developed, because it's been a huge focus of our association for a number of years. And again, we are happy to share what we have learned and how we've developed this, so you all, it doesn't take you 25 years to get to where we are now with the evaluations and supports that we provide to our network. So again, kind of level setting here that of the why Family Resource Centers. I think you all see that in your community. That's kind of what the passion is that drove you here to be part of this leadership team. But what we were seeing historically in Colorado was that not having that brick and mortar point of person there, to really be able to help families when they were needing a one-time support, when they were needing access to some basic needs of, on the screen here, healthy foods, employment, utilities, stable housing. They really are needing that support. They're needing that help in navigating the multiple systems that we do have in the state to help support families, but that navigation piece, if folks are really already stressed out and really already having challenges and not being able to access those services because of barriers that the systems have put into place, can really lead to some poor outcomes for families. So the benefit of a resource center for communities is really having that one-stop shop and having that access to this one-stop brick and mortar family resource center may not be the one that provides the childcare, but they may know exactly who does in that community, really being that community navigator and liaison for families to be that true preventative arm. And we'll show you some evaluation and results that we have of really keeping families healthy and strong. It's very much of a preventative model, working with families who may need access for maybe it's just one time they're coming into that brick and mortar family resource center because they need help this 1 month with utilities, or maybe it's a family that you're working with long term. So it varies, but that's the goal of family resource centers throughout Colorado, is really to be that community navigation and support. So in Colorado, all of our family resource centers look differently. They operate somewhat differently. So here's a snapshot of 3. Surprisingly, we have more resource centers that are in rural areas than we do in urban areas in Colorado. They really have a need in their community for that brick and mortar place for families to come that's not identified as this is the child welfare agency. It's really, this is where I can go for yoga classes. This is where I can go for Cooking Matters classes. And if I need access to utility assistance, or I need access and help navigating SNAP assistance, I know I can, ask questions, and whether they provide it or not, they can help me with those warm handoffs. So this is a difficult slide to pull together when you're talking about when we talk about typical family resource center services, because we do pride ourselves on the fact that all family resource centers are unique, because the services are unique to their community. And we pride ourselves on that. We pride ourselves that the model that we talked about earlier and that Patty's going to help work with you all in implementing statewide is a model that's flexible, where the agencies can still provide what is needed for their community and still using this overarching model. So some family resource centers are providing healthcare and nutrition services. early education, preschool programs, but not everyone. So parenting programs, fatherhood programs, youth development, summer camps, after school programs, but not all of them. One center may be providing they may have a robust after school and preschool programs, and another center down the road may not do any of that, and they may have a huge food pantry, takes a huge footprint out of their family resource center. It's going to look differently depending on what that community's needs are and what the other providers are in your area. They're not all focused on early childhood. We do have a lot of family resource centers that provide adult education, job readiness, and life skills trainings.
Okay, so I'm gonna just walk you through a little bit. I think it's helpful to understand like how we came into existence originally. You might see some similarities, you might see some things that are different. And then just kind of how we got to where we are today, because I think it helps think through where we can maybe truncate this timeline for you guys, and that you don't have to go through such a long period of time to kind of get to where we are. So over 25 years ago, FRCA, or the Family Resource Center program, was established here in Colorado through a kind of joint public-private initiative, but it was really our governor at the time who saw a vision for wanting family resource centers in Colorado. And the vision came from, there was a recognition at the time that families were not accessing all the services that they had available to them. So a family might have some kind of a crisis point happen and would identify, okay, I need help with rental assistance. Like if I just had rental assistance help, that might get me through. And then they would go to that, would have to figure out when to go to that agency. How do you get there? What are the requirements? And when they would get there, they might get assistance with that. But that person at that agency was not going to ask them, what's happening with your food security? Do you have childcare? What about your job? Do you have transportation? They would only provide that one support. And so that family wouldn't even know that they might be eligible for other things. Or if they did know, they'd have to figure out, what are the hours for that office? How do I get there? What are the different eligibility criteria? So at the time, there was a real recognition that that wasn't working well for families. So that was one point of contact. And then the other piece was a real recognition for families who are already engaging with social services or human services. There was also a real stigma about going to that building for that help, because there's also potentially a negative association if you're already interacting with child welfare, or maybe some other experiences that you weren't opting into, and that's in the same building, kind of the same people, providing those services. So it doesn't feel like a kind of place that you want to go to ask for help. So there was this idea, what if we had these family resource centers that are kind of grassroots community centers that could have kind of these life coaches who could maybe help connect families with all the services that they're eligible for. And also that it might be a place other people in the community are going, not just families who are, maybe identified as having a need, but just anybody could come to, as Shauna mentioned, maybe you want to go to a yoga class and that happens to be the provider in your community. So that was the original vision. I think there was an RFP process basically in place at the time that the Department of Human Service put out an RFP. I think there were 21 centers that originally, I think actually it might have been less than that, 18 centers that originally applied to become resource centers. And it was a really successful program. It was 5 years, this pilot project, and it really took off. And then we just had a change in governors in between there. And for the new administration, it just wasn't a priority anymore. So the resource center program got kind of lopped out of the budget. So there was a statute created way back in the beginning that kind of dictated what a resource center is in Colorado. So that's still in effect, even though we're not a part of the Department of Human Service anymore. So we have a weird relationship there. But basically the members who were participating got so much out of it that they applied for our 501c3 and they created the association. So really it was kind of folks at the ground level saying, if we could all have something that would help us come together, I think we could have a bigger impact. So that was really primarily the first 7 years of the entity. A lot of what we did was just look for pass-through funding because what we've identified is, depending on the size of a resource center and where you're located, and as Shauna mentioned, most of ours are rural, it's really hard to compete for some of those big funding streams, honestly, like whether it's federal or state or local. If you're a resource center with like 2 staff, you don't have the capacity to write a grant or apply for funding that you might only be serving, I don't know, 100 families a year, right? I mean, you're not going to have those big numbers, that big impact that some of those other folks do. But if we could put those proposals together as a group and say, in Colorado, we're going to impact this many families, it made it a lot more accessible to participate in some of these bigger grant initiatives. And so that was a big part of the early years of what we did. And then we also brought everyone together 4 times a year, physically into one location, all of the executive directors, to just do like peer sharing, talk about what are we seeing out there, what are best practices, what can we learn. We would invite other groups to come in and share best practices with us. And that was pretty much what the focus was. And at the time we had just the ED and I think 1 staff person, and this is before my time here, but that's kind of all we did. And then with the basically with the stock market crashing in 2007, 2008, the funding really dried up in Colorado. It wasn't as easy to write these grants for, hey, we have a great after school program, and that qualifies as like gang prevention, right? You could be really kind of broad in what we were accomplishing. And really the state and other foundations came to us and said, if you guys want to stay competitive, you're going to have to move to more evidence-based curriculums, evidence-based practices, because we don't have very many dollars to go around, and we have to put the money where we feel like we know we're getting some outcomes. And really up until that point, we were collecting outputs. To be honest, we would say, how many people came to the after school program? 10. And that was kind of it. There wasn't really a lot of demonstration of, well, what happened with those 10 kids who came? How do you know that it was an effective model? So that was a really big hurdle for us, because then I'm hearing a little bit of that too, that Charity, you mentioned, it's when you have a lot of independent thinking and kind of wanting to, like, I know what's right for my community. That's around the time I came in, and it was hard. It was really hard because we mostly had at that point in time still the founding executive directors of all the centers were still in place. And so those centers had really been formed from like, I know what's right for my community. What you're saying in Denver is not what's right for us. And it was a real struggle to get everybody on board. But I think what happened is the centers realized if they didn't, they wouldn't get the funding anymore. And so then they would end up closing because they just weren't competitive for the grants. So everybody kind of shifted to some things you can still do in your own way, but some things we're going to have to adopt these kind of evidence-based and best practice programs. So once we kind of got through that phase, then the centers really said, well, now that we are having outcomes for families, we don't have anywhere to collect it. A lot of folks are still using Excel spreadsheets, which made it really hard to show any kind of outcomes, right? It was hard to demonstrate. How do I know that what I did actually was an improvement for this family? I know it because I see the family, I talk to them, but like I can't put it on paper. I can't send that to a funder. So they actually requested for us to look for a database that everybody could use together. And so the way that works here at FRCA is we use committees to make decisions. So we try not to make decisions kind of top down. We try to have it be from the group. So kind of like what you're doing today, that you're together trying to come up with how is this going to look, that's the same idea. So we have a program and evaluation committee that the committee is made up of center staff along with some of our staff. And they looked at all the different databases that were out there. They picked our first shared database, and we jumped in. So with that was another several years, as you can imagine, of just getting everybody trained, deciding on what demographics are we going to collect, how do we know who has access to what? We don't want everybody to see everyone's data. There are a lot of pieces that we needed to figure out that you have already thought of, right? You're already thinking about that now before you even start the database. We didn't have any of that. It took a lot to even get agreement on what are we collecting and how are families going to feel about collecting that in those pieces. So once we did that, though, we were able to have these reports, right? These independent evaluations of the outcomes that were happening with families. So at our level, at the association level, we're not really interested in what's happening with individual families across the state. We're just looking at all the data from all the centers together and seeing what happened with families. Did they actually improve or not? What areas are they seeing improvement in? And trying to figure out if we could directly tie that to the work that we were doing with them. And we use Omni is the independent evaluator that we used all those years ago, at least as far back, I think, as 2010 that we've been working with them, that they would look at that data and could be able to say, yes, what you did actually did have an impact on this family, and we can directly tie that together, which made it really exciting that we could then be really competitive still for funding that a lot of other folks couldn't, because again, funding was very sparse at that time. And we could actually say, if you invest in us, this is what you're going to get. You're going to get better outcomes for families. So really exciting times back then that we were like, okay, we knew all along what we were doing was good, but now we can actually like demonstrate that. And so kind of that next phase was then centers, our funders and partners and stakeholders said, we know you guys are doing great work. You have the data that shows it. But when we go to all these different resource centers, it's hard for us to find the thread of like what makes them similar. They all look very different, and help us understand what's going to be the same at every center. And so at the time we went back to our statute to look at what did the statute say you have to be doing. And the statute says you have to be doing resource and referral, which I think is what everybody thinks of with the resource center, right? Somebody comes in, says, I need help with accessing childcare. You would then either directly help them with that because you have it in your center, or you would be able to say, let me set up an appointment, or let me help you fill out an application with how you are going to get connected to that. And I think that's pretty much what most people understand as a resource center. The other piece is described in our statute as wraparound case management. We don't use that term anymore. We call that family development work. And that's really for the families who want it and are interested, is that you provide something that looks kind of like life coaching, basically, where if a family comes in and says, you know, I need access to childcare and not sure how to do that, that you would still provide that resource and referral, but you would also offer, are you interested in coming back in and having an appointment with someone who can maybe look at everything that's happening with a whole family? What's big picture happening, and how can we help you get to a place where you don't need to come in anymore? You know, that we can kind of get you out of this crisis point and not just do kind of a one-off emergency service touch point. And it's completely 100% optional. Definitely not every family that's coming in is doing this. It's completely based on each individual family's needs. And so we decided to look for refining our CFSA tool. We've been using that Colorado Family Support Assessment tool for a long time, but we did a revamp of it around that time period. That's where it's the 2.0, to really hone in on like, how are we all collecting this data the same, really having agreement on who are the families we're offering this to, who are the families we're not offering this to. So that was something that kind of came with the whole membership. The whole membership had to be in agreement on that piece. And then we also at that point came into contact with California and the standards of quality for family strengthening and support, because at the time they were the California network standards for family strengthening and support. They were not anything that was adopted nationally. California had created those. And we were really excited to be the first state outside of California to adopt those, because it was a training that we could have every center participate in to really establish, this is what we're agreeing to as the criteria for high quality service and maybe foundational quality service. And can we all agree to be setting goals toward providing high quality service for families? So we're the trainer of that training here in Colorado. And we from that work helped co-create actually the National Family Support Network. So we met with California, and we all of this really came out of that. We knew the data we were getting from the CFSA 2.0 from those evaluations with Omni was demonstrating that we were really having an impact on families. And we thought, this is something we should share. We should be like sharing this with other states, because maybe other folks want to use this. And so we started doing some research trying to find what other states have family resource centers, who has a network. And California was one of the first groups we came into contact with. We hosted here in Denver the very first convening of states we had found that had some kind of a network. I think there were 9 in the beginning, that very first meeting here in Golden, Colorado. And that was, I think, in 2012. And then from there, together with California, we co-chaired kind of on a voluntary basis. Let's see if we can keep finding who else is doing this. Like, there's got to be more states. And I think the next convening had 14 states. And from there, it's kind of kept on growing. And it got to a point where the standards became the national standards, no longer the California standards. And then we also helped co-found the national network together with Andrew, was our who is now currently the ED of that organization. He was kind of the point person with us here on staff to help create that organization. So really excited to see that come to fruition. And now there are 33 states that have a family resource center, something that looks like a family resource center network. And then so we've adopted the standards, we honed in on the CFSA tool, continue to have really great outcomes demonstrated from that. A lot of folks who are outside of Colorado use the tool, and a lot of folks here in Colorado who aren't resource centers also use the tool. So we had to really develop a streamlined training that would go with that so that it could be replicable outside of our network. And then from there, we've really, the most exciting thing probably is that through our research with Omni, we have submitted to being on the California Evidence-Based Clearinghouse. So hopefully we're just waiting. There's apparently a very big backlog from the pandemic of reviewing tools to be put on the clearinghouse. And so we're just in the very final phase of having that approved for the clearinghouse. And what that would mean is that the CFSA tool would be approved for federal funding. So if you're using the tool, you could apply for a lot of other funding streams just for doing work you're already doing. So really exciting to hopefully that should be like any time now that hopefully gets approved. But I know that was a lot, but I do think it's helpful to know it took us 25 years to get that far. And I think if you guys can come in, toward these last 5 years, you don't have to go through all of those ups and downs that we did. And we hope that we can share kind of what we learned along the way. But I do think there's some definite parallels with kind of just that readiness to change, and like how do you get everybody to buy in? And I think now that we have all this wonderful evidence that we know this works, it makes it a lot easier than just kind of going off of, well, we're pretty sure because families tell us that it works. We actually know this works. So excited to share that with all of you. I'll go to the next one, Shauna. So our network is set up with, as Shauna mentioned, 33 member centers. They apply for membership with our organization. It's a pretty lengthy process. We have pretty high criteria for folks to be able to become a member. And then our members pay dues to belong to our organization. So that helps us kind of keep things running. We'll talk a little bit more about how we're set up and the benefits in a moment. But there are other models out there, of course. So there's networks in 37 states right now. The largest network is in California still. And a lot of that has to do with when we came into contact with California all those years ago, we found out that the definition of a family resource center there was very different than ours. You could apply to be a member as an individual. So if you're a family therapist, you could apply to become identified as a family resource center. So they have a very different structure, a very, very much broader definition of what a resource center is in California. So they even have like networks within counties that belong to the bigger networks. So it's thousands of folks who are identified as resource centers. Are they all collecting data on families and all using the same tool? No, it's more of an agreement to an approach to working with families is kind of how it's defined there. The second largest is in Kentucky, and they have 888 school-based resource centers. I believe in Kentucky, there is a resource center in every single school in the whole state. So it's huge, obviously a huge network. What we've learned from coming together every year and hearing from each other is that can be amazing because everyone has access to it. Everyone who has a child has access to a resource center. But what we've also found is if you need to pivot and there's like new funding, new trends, new best practices coming down the pipeline, it can be very slow to be able to respond to that when you're in a more bureaucratic system where there's a lot of steps to implement changes and respond to emergencies and respond to change. So there's some like real pluses and minuses to all the different ways that resource centers exist in their states. And I think part of that, what's exciting about what you'll be working on is figuring out what the right fit is for you in Alaska. And it doesn't have to look exactly like what we have here. There's, you know, flexibility to making sure it works for what works for you. So I think with that, let's see, I can talk a little bit about the outcomes. So this is the most recent external evaluation report that I was mentioning from Omni. So we know that families demonstrated statistically significant increases in areas that protect against child maltreatment, which a lot of you are involved with the child welfare system is, we all know, is super important, right? If you can keep folks out of that system and stay in the prevention space instead of having to work with families who've already been identified, that's great. We've also seen statistically significant growth for families, regardless of their race or ethnicity, in economic security. And then also that our members are helping families experience growth in critical areas that support well-being, specifically housing, employment, and debt management. Those are 3 areas from that CFSA tool that we've really seen some specific growth, which is huge, especially coming out of the pandemic, because those were some of the areas that were hit the most for families. And then if we go to the next one, Shauna. And then the other thing that we've really learned is that the resource centers have become trusted hubs in their communities. So resource centers know what they're doing. The families typically know what the resource center is doing. A lot of it is word of mouth, is how families come into contact with a resource center. Some of it's advertising, but a lot of it is just folks referring other families with how to find the resource center. But what we didn't necessarily expect, at least here in Colorado, we have a pretty big problem with wildfires. That's something newer for the state and can completely devastate whole communities depending on how large they are. And so all of a sudden, families who've never accessed a resource center all of a sudden are needing help, that they like don't have anything, don't have shelter, don't have food, don't have clothing. And what we found is immediately the resource centers become kind of the hub for those communities. If people want to donate, if they want to come and volunteer, if they want to drop off supplies, if it's a family that needs service, resource centers are really well positioned to come in to that gap when that's really not necessarily what they were meant to do, but they're really well positioned for that. So it's kind of a benefit that we didn't necessarily have in mind when they were originally created. And then this next one is the reference from this was a study that the National Network did together with Omni here in Colorado, to really see what the upstream investment benefit is. So for every dollar that's invested in a resource center, it's resulted in a $2.92 savings on the child welfare system, again, because you're preventing folks from accessing services. So really exciting. I mean, to me, that's like the huge selling point right there. And then from there, I think, Shauna, am I going to hand it off to you?
You are.
Okay.
Okay. Don't worry, all a break is coming. So thinking through, we talked a little bit about kickoffs and excitement at the beginning of this about the support that members will receive out of this network. Supports, and we'll share some bullet points here about some of the benefits that our members receive and kind of get your mind thinking here about what would be helpful in Alaska for members on your state. So for us, we, like Mandy was saying, we've established that statewide service delivery model. We're providing the high quality training for things like the national standards of quality, motivational interviewing for all staff in the family resource centers, and we provide the training and ongoing support and community of practices for the tool that we use, that CFSA 2.0 tool. So that's a benefit of all of our members. When we survey our members every year, one thing that always rises to the top of what they value the most is peer networking around the state, and peer networking for their different positions that they have in their local family resource centers. So executive directors really value peer networking with other executive directors. It can feel lonely at the top there, right? We do a lot of sharing of best practices throughout the state, whether that's best practices for nonprofits, best practices for equity, diversity, and inclusive trainings, best practices. It's a wide statement because we provide a lot of training and support for our member centers, depending on what they're telling us their needs are. Through COVID, it was different. They asked for a lot of best practices around self-care and providing self-care strategies for their staff. That really was a big ask of them, and we set up processes to hear from them and kind of have those continual feedback loops for what that peer networking and that group technical trainings and technical assistance needs to be. So we provide leadership group trainings, data learning communities, fundraising, finance trainings, lots of different things. We are positioned as a state network to provide one-on-one technical assistance for whether that's one-on-one technical assistance for the model implementation, for, you know, my staff need really trained and walked through. Maybe I've had some staff turnover here. They need, you know, new training on how to use this model, or whether that's one-on-one technical assistance for organizational capacity. And that's really on our end, kind of Mandy and my role of things that we love to do. So a center may reach out to saying, could you provide support and technical assistance on our next strategic plan? Could you come in and help my board with understanding how to read financials? Because I have a big board turnover here. So that technical assistance, again, it looks different depending on what their needs are, and those needs change. So we try to be agile in our offerings and make sure that we have our ear to the ground as the network of what the need is statewide. We provide a statewide advocacy services to our members. We do partner and contract with a lobbyist who works closely with us, making sure that we know what's going on the legislature for families' needs and are able to respond appropriately for that. It helps with some state funding that comes to family resource centers, as well as more issue-based legislation that is going on here in Colorado. So we talked already about a shared database and the benefit of that. I'm not going to repeat that, and the benefit of external evaluation. I think Mandy just addressed that. We do provide some joint funding opportunities, and for us as a nonprofit association, that looks different year to year about what foundations we are working with and those pass-through dollars that we can provide to our member networks. We're constantly looking for more pass-through dollars for our member centers, and it ebbs and flows depending on the economy. And Mandy mentioned this of kind of how we have developed and grown, or really kind of organically over those last 25 years. And it really all started with pulling all of our members together We do that currently 3 times a year, where we host a virtual meeting 3 times a year for anyone, any staff member part of our network can come and join to learn about the state association, what's happening across the state. That is open to all staff with all of our family resource centers. 3 times a year, we also pull all of our members together for an in-person meeting. And that we ask the executive directors to come. And that is more leadership development, skill building that we provide there, as well as we may have some action items that we need help with the executive directors to lead the association forward. So it's very kind of participatory model that we have for the association and our members. I'm trying to get through this quick so we can get to break on time. So I'll just talk really, really fast. Our model, like I've said, we are a nonprofit. In our bylaws, it states how many family resource center executive directors need to be part of our board. So we do have board members that are lawyers or are, their background is in finance, they may work for a bank, but we do value the leadership from executive directors of our member networks on our board as well. And their input to know what is going on out in the community. So that may look different depending on how you all evolve for that. But this is just kind of a under the hood here in Colorado with the association here. Helping to lead the board are board committees. So we have a membership committee that is made up of a board member, a chair of that is a board member, as well as staff and members of the family resource centers across the state, helping us guide what our membership criteria is, what our dues structure is for our members, really giving us feedback on what technical assistance we need to be providing to leadership. That committee helps us form those decisions. We have a development and marketing committee. We have a finance committee. Those are typically made up of more of a board members, though we'd love more involvement from the member centers, but honestly, they're also focused on their finance committees and their marketing and development. Our program and evaluation committee is one of our largest committees. It's a great learning professional development opportunity for some participants in that community. Maybe they are learning how to do, prioritize their database work in their center. So that's a large committee that we have, really focusing on what we need to be collecting, what lens we need to be collecting the data in, and how we do the evaluations across the state. Our largest committee to date is our Equity, Diversity, and Inclusivity Committee. And then we have an executive committee. So I am going to pause because that was a lot of information. And we want to come back and do the next step that we have is to really hear from you all. And we were hoping to get that done before break, but we need a break. So we will break and come back at 10:45 is our goal. Get some fresh air and stretch. And then we'll do discussion. Welcome back. Welcome back, everyone.
Okay. Before we jump right into our second part, just wanted to allow a couple minutes for if anyone had questions from the first part.
I don't have any questions, but I just put it in the chat that it was just really helpful to hear the origin, and it made it feel doable. So grateful for that context.
Good.
You may have said this at the beginning, but are you going to send this slide deck out after? Okay, perfect. Thank you.
Yeah, Sean is going to send out a follow-up email at the very end that'll have also the link to the recording and information for the next meeting. And yeah, we can definitely include information from today. Yeah.
So I have a question quick. I actually have several, but I don't know that they all fit right here. So, but when you talked about, and I'm putting on my hat of like, as we're growing and building and partners are learning about this and wanting and interested and communities are interested in, my thought was two questions about what FRCs look like, because you had talked about like brick and mortar, and then you talked about like in schools. And one of my questions was, have you ever had a community create something that is like a virtual FRC? And the other thing was, with that same kind of thought, is what about faith-based entities? Because you mentioned like maybe it not being like a child welfare agency due to whatever stigma that might create or keep people from entering. But what about the other end of this too, with like faith-based entities? Does that create a problem? Because I see of like 3 here locally that are kind of already doing this work, and I'm curious about that.
Yeah.
I think those are really good questions. So for the first one, yes, we definitely have. So the brick and mortar versus virtual piece is a tricky one. So especially during the pandemic, obviously like a ton of services shifted to virtual for everybody. And most of our centers are going to continue that. So for instance, doing the family development service, using the CFSA tool with families, that coaching, a lot of families have said was more comfortable virtual because maybe they didn't have to find childcare, or maybe they felt like more comfortable if they were in their own living room sharing kind of what their story was, as opposed to being in a strange space where they don't know people. So definitely a lot of the services can be provided virtually. I think the one piece that we've identified is more on the operational side, that if you're collecting grant funding, if you're have to have somebody doing bookkeeping, if you have grant agreements and just paper pieces and those things, you do need to have some kind of a brick and mortar something somewhere where that can be securely stored. It's not best practice to have that be in somebody's spare bedroom, you know, just for HIPAA compliance too, like if you're getting family information. So in that sense, I think it is helpful to have some kind of a secure brick and mortar location that's not somebody's residence where information is being collected. So a lot of our centers years ago, even prior to the pandemic, moved to, like in the urban environment, it was hard for families to get to the resource center, right? It was maybe like 3 transfers on the bus to get there. When they realized a lot of our families have kids at this school, could we maybe like rent an office there 3 days a week? And then if the families are already there to pick up their kids, let's just meet them there to do some of this work, whether it's programming, you know, it could be after school programming, it could be meeting with the parents to do kind of the CFSA work. So I think it definitely makes sense, like go wherever, however it's going to be easiest for families to access service. We have a really cool new one where they just started their RV where they actually are going, they have a route, and then they have different stops every day where they go that are easier for families to get to, where they can do the diaper bank, you know, a small food bank, can provide some services directly out of the RV. So yeah, we have a lot of different examples. It doesn't have to be everyone coming to that location. You can, it's however it works to provide the service. So hopefully it helps answer that question. And then your other question with the faith-based one, we've had that's come up a lot of times in the past here in Colorado too. We have had entities apply to be members that were faith-based. And I think you're at a really great point where that's something you can think through as you're developing your membership policy. Like, that's really up to you. Is that going to be prevent families from coming in? Or is that going to be comfortable for families to come in? And you have to think that through. I think the only time it really came up as a hard and fast no for us was anytime someone was accessing state or federal funding that prohibits, proselytizing. So if that center wanted to participate in that pass-through funding opportunity, we would have to say it can't be in a space that has any religious documentation on the wall, or would any way make a family feel like you have to agree to something else in order to receive the funding. That was kind of the only like actual written rule that we were like, that's a hard no. But I think those are all things you need to think through, really, that you can kind of decide how that would work best. Hopefully that answers that question.
Good.
Thank you.
I think we have time. Another question before we jump in to an activity?
I'm not sure how to really articulate this. I think what I was thinking when you guys were talking is that, like, at BBNA, we have a lot of these things that you guys are doing set up, but they're in separate places and in separate buildings. And so did you guys have any experience in kind of working with organizations that were consolidating these support systems? So like we have workforce support, we have early childhood care, early childhood education. We have the food bank that's based in our building. Like, do you have any experience in helping organizations to kind of consolidate those into one place that's more easily accessible for folks?
You want me to answer that, Mandy? I'll jump in.
Yeah, sure. Why don't you answer that one, Shauna?
So our centers all look different. Some are like, they just have one location. Some are really large nonprofits and they have multiple locations like you're talking about. Maybe, across town is our thrift store, but our food bank is over here, right? So when you start diving into the model and what we call the family pathways model, it's how do they all work within that model, and how is communication work with families? So if you're putting families first, you're thinking, are there hurdles in place because of that? Or maybe there's not. Maybe where that thrift store is located is exactly where that thrift store needs to be in your community. But how are they accessing that? So if you're thinking about it through that family lens, you're still providing all of those services. It's just, what is the ease of access, and what's the communication between and among your staff to ensure that the access for those services is achievable for the families? So.
Thank you.
Yeah. All right. We want to hear from you all. So I have developed a whiteboard here in Zoom. We'll see how this works. Where you all heard and have talked all morning about benefits and the excitement for family resource centers. And I would like you all to put that on the whiteboard about what you see are the benefits for your community, for the state. When I launch the whiteboard, some of those benefits and the excitement can also be concerns. So on the whiteboard, you'll see one box for the benefit and one box for concerns. And it's just kind of sticky notes. We're going to put sticky notes up there when I launch this. And an example would be, I'm really excited to have a statewide database, but I also have concern about that, right? So I see the benefit, but I see concern. So maybe for you, that sticky note is going to live in between those boxes. That's fine. Just really wanting to hear from you all where your head is and your heart with the excitement for this and things that you think are going to be beneficial, and also the concerns. So let's see if I can launch this. You're going to go in on the left. You can grab a sticky note, or if there's a sticky note already there that is not filled out, you can just start typing in that sticky note. You can also lock your sticky note so nobody else is typing over yours. So let's see. Okay. Let me know, come off mute if you're seeing this and can start typing. My title of mine, the titles I put in are not appearing.
I think they appear on our end.
Okay.
I'm not able to see any of them. I'm just seeing sticky notes with colored boxes.
Okay, that is strange.
I just see a blank screen. I don't know.
Well, we'll see if this works.
I was able to type on a sticky once I clicked on it and just started typing.
You're not even seeing it.
When I've done this in the past, there's been like a toolbar at the top that lets you like pick how to type in here. But I don't see that now.
Okay.
I think if you click on the sticky, it pops up. Like there's a little toolbar that pops up for each sticky.
You're on here, but why? Okay, I'm going to copy the link to this in the chat for everyone and see if that works better. And if you might have to open it in a separate tab. Let me know if that works, and if it doesn't, we'll just do this as a shout out.
You can also direct message Shauna or me if you want, and we can type in for you in the chat. Because it looks like a lot of them are working.
I had to send a request. I'm not sure. I think because my Zoom login might not be the email you guys use for me. I'm not sure.
Okay. Well, we can close if this is not working, and it's a small group, so we don't have to be so high tech.
I think it is working, Shauna. I don't know if you, yeah.
Okay.
Is everybody just seeing them on your second screen? Like if Shauna's sharing, is that where you're seeing them?
And that's where I see it, just on the main.
I did have to request access too, so I don't know who has the power to grant that.
That's what I'm trying. I'm not getting those responses. I go under here. No. Okay. You can see the comments. Yeah, let me stop.
I'm seeing everybody's comments, so I don't know if you're not seeing them. I think other people are too.
Yeah.
I am too.
Yeah.
Okay. Well, for those who can, if you wanted to shout out benefits or concerns, if you can't get in, then Mandy can type those in.
Or I can share what I see so far for folks who maybe aren't able to see.
I can't share my screen with you without closing it down.
All right, I can see some of the benefits are consistent standards, collaboration, safe children, access to a like-minded group of professionals. This one is really testing my eyesight. Partnership, family growth and confidence, tribal and non-tribal partnership development, unified support and consistency statewide. And then some of those that are in the middle, kind of benefit and concern. I see stronger families, public-private partnership, organization and breaking down silos. And then concerns about a statewide network. We have sustainability and long-term commitment, funding needs, long-term funding, buy-in. That was me with the testing one. Sorry, that was. So I think we do see some consistency.
Mm-hmm. Great. And I definitely hear a strong voice for the need for evaluation, consistency, maybe some concern with what that looks like too. Yep. Good.
It sounds like too, some of what Charity was sharing at the beginning too, of just the sustainability and long-term commitment, like making sure people are going to be kind of bought in and stay the course, even if it gets a little challenging maybe, or you know, just to make sure it's like a long-term commitment. Yeah.
Mm-hmm. Good. I'm going to close the whiteboard. We will save all of those comments and again, be sharing out everything to this group because it will help form moving forward for you all with some of that excitement. So good. We are going to move on to some more great interactions. Let me open up my slides here. And with this group, I know all the leadership group that is not presented today, is not present today, but we did want to, as one of the action items, talk about how this group is going to move forward with your decision-making process. So I'm going to hand it off to Mandy.
Yeah, so we've just found in general, not just with the network, but in general, when you have collaborative groups like this, it's really helpful to establish early on what the decision-making agreement would be within this, even just this group, this space, so that we're not moving on without everybody having a chance to weigh in on whether or not we're all on board moving forward. So, really, there's kind of three common decision-making strategies. One is simple majority, so just voting. And then if you have 51% in favor of something, then that's the direction we're going. The second option is major majority, so that you would have an established percentage, whether that's 75% or more or less, that would have to be in favor of something in order to move forward. And then we have consensus, where everyone is in agreement before moving forward, that we all agree 100% before moving forward. So within these, you know, I think we can pick one of these that you think would work best for this group, and we can talk about it for a moment. But I would allow there could be something else, like maybe you have a different method that you've used somewhere else that you like. I know one method that's come up a lot for our groups is it might be that you weren't a part of the majority, so that you were not in favor of what the larger part of the group was in favor of. And then we kind of talk through, is there slight changes we need to make in order for you to be kind of, it might not be a full-on thumbs up, like, yeah, I love it. Maybe you're a sideways thumb of, it's not my favorite, but I can live with it. Might be another option. So it's within some of these, you can have different gradations of, yes, I love it, to, yeah, I don't love it, but I can support it because I see that that's what most people want to do. So just wanted to open it up to this group. because it's a smaller group, we would normally do this in pairs, that you would break out kind of and talk it through in pairs. But because we're a pretty small group, just thought it would be helpful to hear from you if one of these sounds most appealing to you. And you can either come off of mute or you can put it in the chat. Or if you have questions that you're not sure about how this works.
I was going to ask, just for me to wrap my head around this, like knowing where we're at and knowing kind of the process that you guys have been through, what would be some examples of decisions, like that realistic decisions that could come up over the next 6 to 12 months for us that we would need to work through?
Yeah, I think that's a really good question. Yeah. I think it could be things like when you're talking through what is our membership like policy going to look like. When I think you brought up a good one earlier, are we going to allow faith-based organizations to be family resource centers? Something like that would definitely be something that I think you would want to make sure everybody's in agreement on, or at least that you have some kind of a vote on.
Another example that we'll address next time, at the next time we convene, is what is our purpose statement. So we'll, start wordsmithing and looking at the overall leadership purpose statement, but how are we going to get to that decision? So I think leaning into maybe other committee work that you all have done, what have you found really helpful with other committees that you serve on, that you found frustrating? This is a new committee, so we realize you have to build trust within this work. So maybe what we decide on today, maybe we have to revisit that in 6 months, and that's okay.
Yeah, you don't have to stay with this forever and ever by whatever you decide today. This could just be the decision for today. This feels right. And then maybe next time we meet, it's like, okay, we need to do something different. It's just kind of for now, what do we think the decision making could look like?
So other boards that I've been a part of have generally been consensus, which is sometimes hard to, get to the end of a meeting and feel like everyone's on board, even if there's room for disagreement and discussion, but at the end we say, okay, we are moving forward with this decision as a group, and we all are agreeing. I don't know how realistic that is for this group. I don't know. I'd be curious to hear from other people, but just for me personally, the ones I've been on have been consensus. And there's pros and cons probably to each consensus or having I think if my thought would be, if we didn't do consensus, then maybe major majority. I would just, these are some big decisions that we're making, and to have half the group not be in agreement, I'd have concerns about that. I'd want us to be unified and be making these decisions in somewhat, even if there's disagreements as we're making the decision, to get to a point where like, okay, most of us can agree to this moving forward. I think that's going to really model to the rest of the state and the members that we're doing this together. We're on the same page. We've put a lot of thought into these decisions, a lot of research, and and we're on the same page moving forward. That would be my 2 cents.
Yeah, I mean, I would agree. I think, just from like a culturally appropriate standpoint to consensus, like sitting, coming, even if it takes longer and it requires more discussion, making sure that everyone's on the same page about how we're going to move forward. Because I think, as Charity and others have indicated, I think it will be better if we're projecting a more unified front, because this is already going to be quite an uphill battle, I think. And so being all on the same page, I think, will be helpful.
I'm kind of thinking that it depends on the type of decision we have to make, right? So I spend a lot of time on committees and boards, and we all say that we're making our decisions by consensus. But when we have decisions to make that are butting up against timelines, our consensus decision really comes down to, okay, we need to have this done by the end of this meeting today. And when we get there, most people support the decision, it moves forward. So I don't know. I think for me, I support major majority. I feel sometimes it's more honest.
Yeah, I think kind of supporting what Paul's saying too, depending on how things are structured, my only concern would be with having like major majority or consensus is when there's meetings, like do a certain amount of members have to be there to be, you know, there to make that decision, because I know everyone gets busy and most of the time you don't have all members present for meetings. And so if there isn't like, whether it's, you know, pretty significant decision or not, sometimes it definitely can impede progression and pushing things forward. And so that's my only concern with either of those.
We maybe could set a quorum then, right, for making some of these decisions to, yeah.
So what I'm hearing is, and feel free to chime in if I didn't capture this, but it's kind of the preference would be, if we have consensus, that's great. If we can start from that point of seeing if we're all in agreement to move forward, that would be, and maybe taking some time to allow for conversation to see if we can get there, but a limited amount of time, so that we're not spending lots of time kind of going in circles. And then maybe as a backup, if we can't get there, going with major majority would be the backup, but knowing that we'd have to have a quorum. We'd have a pre-established quorum for doing a vote. So if there's, say, 12 people on the leadership team, do we need to have a minimum of 7 in attendance in order to vote on something? And would that be true? I guess my question there would be, would that be true for both consensus and major majority, or just for if we have to go to major majority?
Can you repeat that, Mandy, your question?
Sure. So regardless of which method we go with, do you want to establish a quorum so that we have to have a minimum number of people participating before we can vote, whether that's consensus or major majority? And it doesn't have to be, you know, over half. I mean, you could say we need a third, but what's the minimum number of people, or what percentage of the group needs to be present in order to make decisions?
I think that is a really important point, because even out of today's meeting, we only have, you know, Abby and I are obviously not going to vote. Well, Abby will vote, but I won't. So when a lot of people don't show up and you don't typically take quorum votes via email, what is the minimum to be able to get anything done? And I feel like the normal 50% guideline is going to be hard to pull off about every decision. So I'm more prone to think that maybe something like, you know, 3 people, or, you know, something like, because this is going to stay kind of a small group probably. Those are just my thoughts. And I agree with what everybody else has said as well.
Well, and I think that's a conversation we need to have with the people who have said they want to be on the leadership committee. Like, okay, do you really want to be on the leadership committee? This is what it's going to entail. You are going to be making some guiding decisions about this network in Alaska. So, and it's going to take some time and effort and collaboration. So maybe kind of having people recommit to that, and then getting down to how many people we actually have. Maybe it's not 12, maybe it's more like 8. And also recognizing I think it would be good to establish that ahead of time. Like, okay, well, if there's 8 people on this leadership team and only 3 people show up, those 3 people are allowed to make those decisions. You know, so show up to the meetings and be a part of it or not, but the decisions are still going to be made, because otherwise I think it would just draw out the process if we're needing 50% of the committee to be there every time. So
yeah, I think that's a really good tie into, Shauna's going to talk a little bit about the leadership commitment next after this. So I think that's a good point to decide how do we make sure, like, who are the people who are actually committed. So I think we can figure that out. I think for the decision making, until we have that number, I think we could say a percentage, like, is it 30% of the people who are on the leadership team need to be present in order to make a decision? And if that was, you know, 9 people, then 3 would have to be present in order to vote on something. Does 30% feel like a good amount?
it does to me.
I see 2 people.
Yeah.
3. Rizal, I see you nodding your head. Emma, does that sound good? Abby? Okay, so if we said you have to have a minimum of 30% of the committee here in order to make a decision, that would be kind of the baseline. And then from what we were hearing before, it sounded like consensus would be ideal. If we can just start from that framework of, let's see if we can all agree. If we're running out of time and it's a decision that needs to be made, though, then we could shift to voting with major majority. Is that where we were landing?
Sounds good to me.
All right. 75% of us agree. All right. No, that's great. I think this is helpful because this is the start of a lot of decisions we're going to have to make. And that was pretty easy. And I think you all have a lot of experience and we already are on our way. So first decision made.
Yeah.
Great. We will make sure we capture that and we'll send that out as well to the group. And then I think with that, I'm going to hand it back to you, Shauna.
Yep. So next, it just segues nicely into what Kristen was already talking about, was the network leadership team. Who is this? That's kind of what we're going to go into next. What the time commitment really is for this and what it really looks like. That's just the natural evolution here. So let me pull up my screen here. So, okay. So in the ideal world, think about the size of this leadership team. The group that has been identified is 10 people now. There are a few people that are not here today. So after we go through this activity, we will discuss, are these the right people? And are there more people, less people? What really does this need to look like now and where you are in your evolution? So think about a group between 6 to 10 or 6 to 12, however big you think is best there. And the time commitment is huge, right? You all talked about what's on your mind and it's just having to be in 10 different places at once. So being realistic that we will be pulling you all together over the course of this year to really do working meetings like this. Well, the goal is to do them virtually, but to be able to carve out blocks of time to come together and do these working meetings where we're taking action to move things forward. That's the time commitment where you have time to carve out 2-hour meetings, 4-hour meetings. Today was 3 hours. We're not going to be meeting every month. We do recognize the fact that in the summer, things kind of get a little bit put on hold there for your warm season. But know that the time commitment is really wanting you to show up and be active in these meetings. We will be assigning some homework. It's not going to be huge homework, but there will be some things to take away from these meetings that maybe all of you have to do, or a few of you, depending on how your leadership role evolves here in the group. So, and simply to be actively engaged in this process of not like, oh, I can join this and also be on my way to the airport. So, and at the end of the day, you're wanting folks that are really committed to the cause, right? That really understand the state purpose. Yes, they have a commitment to the Family Resource Center work in their neighborhood and in their community, but also have that larger state perspective to support all families throughout Colorado. So
Not Colorado, Alaska.
Oh, Alaska. Oh, okay. It's Friday afternoon. I'll just use that as my excuse. So when I think about your evolution and where you all are, I think of 3 real main roles that you'll need in this 6 to 12 folks on your leadership team. And I've chunked them out here in kind of how I've defined the different roles. So a good leadership team understands the strengths of each other and can lean on one another. So in this chunk of time that we're going to spend, I want to hear more about what you think your strengths are. And as I read through this, and also think about the other folks on the call, if you know them from working on other collaborative work, the strengths that you see in them. So again, all teams need to balance each other with those different strengths. So you have your community informants, your connectors and power brokers, those real big visionary folks, and then you have your organizational leaders. So what does this all mean? So the experience that the community informants bring, they really have access to those multi-sector data. They're the folks that are always looking at who's in need in Alaska, what are the resources in Alaska. They know these questions. They're hooked into what is going on statewide. They know where the gaps are in Alaska. These are your community informants. They may be working in a specific community and know the answers to some of these questions. They know the local, regional, state service systems. These aren't folks that you're having to kind of train up to know these systems. They know them, they know how to work within those systems. Some of the talent, skills, strengths that these folks bring to the table, this list is not exhaustive, so it's just some of the strengths and skills. They're really good communicators and collaborators. They are those bridge builders in their community, in the state. And they know equity, diversity, and inclusion work. I would put this a bit forward that they know really how to implement that work in their communities, in their regions, statewide. Your connectors and power brokers, those are your visionaries, your big picture folks that are going to message that big picture statewide. You definitely need these folks on this leadership team. So these are the folks that are the real, they have the passion for this work, and they're really good at communicating that passion to others. So they're the relationships, they have those relationships statewide with the big decision makers, funders, county, state, to message your message moving forward for the state network. And they have those relationships. So they have the passion, they're the strategic thinkers, they're consensus builders, good communicators and team players. Honestly, you could put their strengths and talents in all one of these buckets. So think kind of those big visionary folks that I am not. I definitely would fall more in the organizational leaders, knowing my strengths. So I know that I lean on those big visionaries to help motivate and guide me. So think about, are you an organizational leader? You understand the stages of organizational development and really what this work is going to take to go forward. Your big connectors and power brokers are the ones that the organizational leaders are going to say, that's great, but it is going to take time. And they're the ones that are going to keep reminding there's going to be a process to this. And that process and that time is okay. They understand those stages of organizational development, experience. They have the experience in developing and or leading organizations. They know the time and effort and lift that this is going to take. They are also visionaries in that they can keep that momentum for others that may lose that momentum after 6 months of this work, because they know that this process is going to take time to get everyone with consensus and to get that majority across the state. So saying that, I'm going to switch gears here for one moment. And I'm going to share my screen, but in a different way. Okay, are you seeing? Okay, my slides here, because I would like you all to come off mute and tell me, you may think I fit in every single one of these categories. Yay! You may think I fit definitely in one bucket. I'm really strong in one of these buckets. And I'm just going to jot down the names of kind of where you self-identify, or maybe you worked with somebody on this collaborative already, and you have seen some of their strengths play out in some of these areas. And just shout it out and I'll type it in.
I'm definitely more of the organizational leader.
I think I'm going to fit more in at the community level just because I'm working in multiple regions and with state leadership. So that's going to be, I think, where I'll be best situated.
I'll second that as well. Community informants, I think I have pieces of the other two boxes, but I definitely think hit all of them under community informant.
I think I fall most solidly under organizational leader, but Dawn, who maybe eventually be a part of this committee, falls more under the connectors and power brokers.
I feel like the community informants is what resonated most with me in my experience.
And Paul, do you lean one way, or are you like, I'm in all three?
No, I think I'm in the first two. I think stronger in community informants, but in my role, I'm also in the connectors and power brokers.
Okay. Good. So thinking through, I'll just go through kind of who isn't here, right? Who was invited, so that, and let me know if you know of them and you know where you'd see their role, or maybe it's a question mark. That's fine. Cindy Smith with the Knight tribe. I'm probably pronouncing that wrong.
It's Nick, yeah, Nick tribe.
Kinnick.
Yeah, she had expressed interest in being on leadership, and Kinnick wants to start an FRC in the Valley. So, and she didn't tell me she wasn't going to be here, so.
Okay. So I'm going to put over here Cindy with a Y and an I, but she's a question. I'll just kind of put the question marks over here. Okay. Emma Dawn was out. Lee Bolin from Resource Center for Parents and Children.
Yeah, she'll be a strong leader in the group, and she just couldn't be here because she's traveling.
Okay. Do you know her strengths? That's okay. She could differ with you about what she thinks her inherent strengths are.
I personally would say she's a connector and a power broker, and maybe an organizational leader. Well, she's all of the above. I mean, very capable and willing to get to work.
Okay. It's interesting how we view ourselves versus how others view us. So that's okay. And Kristen Schwett from Fairbanks, North Star School District. Christine.
Oh, Christine, shoot. Yeah, she is a go-getter. She already started an FRC kind of with a group in the community in Fairbanks. But I know she's really slammed. And so I'm hoping she engages as a leader because she's one of the first 2 school districts to really launch this. And this will be one of the ones where it'll be important that we get a lot of buy-in to use kind of standards and that because they're already establishing themselves in some systems and they've kind of built it into their McKinney-Vento system. So.
Okay. And then Laura Griffin. She is from Kodiak Island.
Yeah, so same scenario there. They already started their FRC in Kodiak, and we're mainly doing it for education supports. But she's wanting to expand it, and she got trained as a trainer for the standards training. So she's involved on kind of the training crew. But again, it's a matter of time if she can commit to the time to being involved in the leadership. But both of those women, I think it's going to be critical that they're a part so that we have a good structure for school-based FRCs as we build.
Okay. And then Paul, he's here. I'm just kind of going down my list. And then Desiree Scott from VOA Alaska.
Yeah, so Desiree manages the kinship navigation, like the kinship services for Volunteers of America, Alaska. And she will be the one responsible for VOA's FRC. And she just couldn't make it because she is traveling. But I would say that she's probably more of the community informant. She just has a really good pulse on what families are actually wanting because she's serving so many of them statewide in their kinship support.
Okay. All right. So
if I could just add really quick too, I mean, so there in our state with child welfare, there are regional co-chairs for each state. One is a state worker and one is a tribal leader. And those women that are tribal co-chairs are definitely in the like connector and power broker level. They are also slammed with being responsible for a lot as co-chairs. And so I will talk with some of them and see if there's any that would be willing to do it, because I think they would be great people. A lot of them have been doing this for decades, some of them over 3 in this state. And so they would be great to have at the table. And they're also well respected in multiple venues. So I think that that would be a good poll if we could get some of them to come in. So I will talk with some of them as well.
okay. Can you repeat for me the title that they carry so I can get that down here? Sorry.
Well, they carry a lot. So a lot of them are there. So like my boss is the family services director for BBNA, but she's also the co-chair for the South Central region. And so they're elected for each region in the tribal caucus. And it's usually the head of a tribal social services organization who's been doing it. I think all of them have been doing it for decades. So yes, but they are super busy. So I will talk to at least my boss and some of the others and see what they think. But they are the head of their family services or children's services, however that regional organization or tribe itself, like NOME, operates as its own tribe. BBNA is regional, CITC is regional, and then they're co-chairs for the purposes of child welfare work with the state.
Okay.
So just to add to that, thanks Emma for that. That's important to note. The co-signers of the compact, so Lola with NOME, Lou, Mary Johnson at Tlingit Haida, there's a couple others, have been approached about this multiple times and have been involved in the conversation, but Tracy at Coeric and have been involved in the AIA, but haven't been able to commit to the time for this particular project. So I just want you to know, like, a lot of them have been invited to the table and have opted out because of the time issue. But certainly they do want to keep tabs on what's going on. So I was really excited that Cindy Smith of Kinnick and you, Emma, joined us. But I agree, like, we need more representation if they're, you know, as we're hoping that there's a lot more FRCs built within, you know, those communities.
I'm wondering, Charity, if anyone at CITC or South Central Foundation would have capacity to, have you approached anybody there?
Yeah, so Deb Northbrook at CITC is definitely a huge proponent of FRCs. She was one of the initial ones to really want Alaska to adopt that, because she and Tammy Sandoval from OCS many years ago went and visited Maine FRC in San Francisco that they were really floored by. And so Deb's been a proponent of the work, but again, it's kind of one of those things right now that they're not able to tackle as they're doing some new model building. And then South Central Foundation, I'm trying to think. I haven't gotten anyone from there involved that I can think of. There might be. Oh, well, actually, that's not true. So Cassie and Lindsay at South Central have obviously been involved in the conversations, but it's not something that they are doing right now because they're in the middle of standing up their wraparound services from primary care clinics for early childhood stuff. So that's a lot of what they're doing right now.
Okay.
That's not to say there's not other people at those organizations that want to step up to the table. I'm just saying that of my contacts, that's kind of where we're landing.
Okay. Well, seeing this and having this discussion, just knowing, I would look at this and say, you're heavy in the community informants, but if you look at where you are in your evolution, that is not a bad thing, right? That you need that community input. And maybe, Emma, if maybe a takeaway is to reach out, but I also want the folks that couldn't be here today to have the opportunity next time to really start engaging and not to grow this to be too large of a leadership team as well, kind of balancing the numbers there. So great. Okay. Bear with me here as I switch screens here. I'm going to jump forward a couple slides. Bear with me. Okay. Oh, why did it do that? Tech issues on my end as I'm trying to jump around. Okay. So the role of your local agency or the state agency or wherever you sit, I wanted to spend some time and acknowledge that for being part of this network leadership, it's not going to impact your day-to-day decisions that you're going to continue to make and move forward in your organizations that you are employed by, right? But from time to time, there can be a time when there is a conflict that arises, and pointing that out for the leadership group. So you wear a hat for your local agency and the leadership role that you play there. You also are going to wear a hat now here in this leadership role with family resource centers across Alaska. So knowing that, I'm going to give you kind of walk through this screen here and share two examples just to know and be upfront about what you're agreeing to do and being able to work through that with this leadership group. So one role that you may see as somewhat of a conflict, but it's really not, is kind of some of the strategic direction. So you and your local agency are creating organizational goals that best serve the families in your community. That's the hat that you wear, or maybe you're doing that at the state level, but it's very focused on behavioral health services, where the network leadership role is creating organizational goals that best serve families throughout the entire state, the way that you all are going to decide is best for family resource centers. That may be different for what your specific community need is if you are a family resource center leader there, or if your goal is to really focus on child abuse prevention statewide, and that's the lens that you're typically working in. This role and leadership role is going to be a little different depending on how you all are going to be defining the reach and the definition of family resource centers. So fundraising and funding decisions and fundraising always comes up. You make decisions what is best for your family resource center agency, for your state agency. The hat that you come to this group is really the supporting decisions that are best for the greater good of the network family resource center agencies, even when sometimes it may not be best for your specific agency. And I'll give you some examples for that. So one, the network may decide or even be asked by a funder to submit a large pass-through proposal that can be distributed to all of your members statewide. It could result in some of the agencies receiving a smaller distribution than they have in the past when they were directly funded by that entity. So being part of the network leadership would mean supporting those pass-through proposals for the good of all of the member agencies, even though they might experience a decrease in their own funding level from that funder. So for us, an example of this, it could be a private foundation comes to us and says, we want to work directly with you, though and fund agent, statewide our members, though in the past we had been funding just 5 of them and working directly with them. So that's an example of just to put in your head about what kind of the hat that you're coming to the leadership group with, of really having and asking for having that state perspective of what is best for families across the state. So I'll give you one more example. The network may require all member agencies to collect certain data points in a specific manner, so that we talked about aggregate outcomes, evaluations can be reported to all the key stakeholders, and you're really assessing that statewide. This may place a burden on many of the agencies who are not accustomed to doing things in that certain way, right? We talked about that as a concern already. Being part of the network leadership would mean understanding that this requirement might ultimately lead to an increased funding, and therefore supporting that requirement for the benefit of all of the agencies and for the families they serve, even though their agency will need to increase their data collection efforts. We see this all the time of, yes, the data collection, there is a purpose for that work, and it is work on our staff to do that, but continuing to message and carry that message through as a leadership team across the state for what is the greater good here. So I will pause there and see if there's any other examples or things that you all think and can think of now that may come up of more of conflicts over the 2 different roles.
No, I mean, I do think there are examples of this with the compact work that, sometimes that means that organizations that were getting funded directly through a grant are now, that funding is being split into the compact. And so being able to just see the bigger picture there and be more supportive of all of the organizations instead of just the ones that have the resources to make those bigger funding applications.
Mm-hmm. Okay. Any questions about this? We've got a couple minutes. I don't want to brush over this because it will come up and we'll revisit this, right? So, okay. So looking ahead, looking at my time here, ooh, kind of close. Okay. Looking ahead, we are going to send out all of the great work that you all did with benefits, with coming up with how you're going to make decisions moving forward. We've done a lot of great level setting here. But looking ahead, we're going to start tackling the next time we meet on our purpose statement, with the goal of getting to the governance and network structure for you all. That's going to be a lot of work moving into late spring. We'll take kind of some break there for the summer months and come back. But through that time, we're going to be working. Purpose statement is what we're going to really kick off the next meeting on, so that we can then get into governance and network structure. And then later, we'll see how far we get before the summer break, get into mission and vision statements for this network. But I think first it's more of what is this going to be looking like structure wise before we can get to that. So that's looking ahead. And this is where I get to give you all homework. Yay! So I want to kick off and give you some context for what a purpose statement is, because it is different than a mission statement. It can be short, sweet, very to the point, but having that unified voice of what this network is really what we need to come to a consensus on in our next meeting. So the purpose of a purpose statement is really giving your audience, your customers, letting them know the benefit of the state network. So if you think about who your customers are, they're your key stakeholders, they're your families, they're the resource centers that are either getting started or going to start. But it's really putting out to the world there what your benefit is to the state of Alaska. So it helps define what this network is for everyone. So this is different. That's why it can be short and sweet, because the mission statements typically are a little bit longer. They focus more on the benefit for the employees and those that directly interact with the network on a regular basis. It helps those that are directly interacting with the network on a regular basis know what their roles are within the network there. And then the purpose statement is different than a value statement, in that the value statement is really focusing on the culture that you want for the network. So how do we conduct business with the network? These are like more of our operating principles and our overall culture that we expect to be working in. So again, working towards a purpose statement, you don't have to think that it needs to be everything in that one statement. It can be kind of that short and sweet part of it. So the benefits of doing this work, the benefits of why we're asking you to think about purpose statements. It increases motivation when all stakeholders understand what is driving your work. It will likely increase motivation among those in this leadership group and those that really are caring about families statewide. So the purpose statement helps meet the network goals. The network is better able to meet their goals when there is a purpose statement that helps drive its benefit. All stakeholders, no matter who they are, know the direction the network is going in and that their contributions are going to matter, even though you're new at this, right? It's where are we going? What is the overarching goal here? It helps to establish loyalty with those stakeholders that you're beginning to cultivate. And sharing what that purpose is, and to feel good about the work that they're doing and in the interaction here with your network. And the purpose statement is going to help distinguish yourself from other state organizations and other state collaboratives. So that's the homework. When you think about writing, I'm going to ask you all to come up, put your creative hats on after this meeting, and you let all of this kind of sink in and you digest it. I'm going to ask you to come back with a couple, maybe one mission statement, maybe two, whatever your creativity juices are flowing. Bring those purpose statements. Purpose. Get those creative juices flowing. So some helpful things to think about when writing that, figure out the why. Why is the network doing this for Alaskan families? Define the network, define who the network serves. Remember, the purpose statements specifically are written for the customers. So you're working to serve families that are in need throughout Alaska, right? What makes this network unique? Again, the differentiating point of that from other state collaborative work that's going on. And then those keywords, those buzzwords, the keywords should motivate, inspire, celebrate. That's the creativity part of it. So I'm giving you some examples to take home. You can, again, you'll have these slides. Specific examples. I didn't give you Family Resource Center examples. I want you all to create your own. So some are, our purpose is to inspire every family in the world to enjoy Sunday dinner together. Our purpose is to support the health and well-being of our planet and everyone who lives there. Our purpose is to increase accessibility for life-saving equipment for patients in underserved, underdeveloped countries. So examples to think about. So next time, come back, get those creative juices going. That's where we'll kick off the next meeting. Okay. Am I doing the poll, Mandy? Let's see.
Yeah, I mean, basically, we just wanted to launch a poll here to look at scheduling the next meeting. And since we have those of you who we know are committed, we think, are those of you who are here. And so we'll let you do the main decision making. So I think, Shauna, are you going to launch that as a
I
Zoom?
will. I have to.
And the ask is which of these meetings you would be able to attend.
Okay.
And you can pick more than one. Just identify any that would work for you. And I know that might take a minute to look at your computer or your agenda, and that's okay. We'd rather take the time while you're here and not have to send you a doodle poll afterward.
So will we be doing any doodle poll to anyone not here? Or are we just going off of selecting it from here? I know we kind of went back and forth on that in planning.
Yeah, that's a good question. I think we can check in with you afterward. I think if we can at least hone in, if we know from this group that only like maybe 2 dates are good, then we could just create a doodle poll with those 2 dates. But if this group identifies, you know, all 4 dates work, then we can send out a doodle poll with all 4. Or we can also just say this is, if there's one that really sticks out as being the winner, then we just, that's what it's going to be.
And it looks like everyone has completed. And definitely Fridays. 2 Fridays there that stand out. So, and then 1 Tuesday. So great.
Was there an overwhelming majority for one of those Fridays over the other, Shauna? Oh, here we go.
Yep.
So it does look like that Friday, April 28th, worked for the most. I think we can defer to, honestly, to Charity and Abby of if you want to just move forward with what worked for the most of the people in this group, or if you want us to do a doodle poll from here.
Up to you, Abby. And honestly, my votes are you know, I'm not absolutely necessary for these meetings going forward since Abby will be leaving the team, but I did vote anyway, so, but go ahead, Abby.
Could I send an email after this to those that weren't here and just inquire about that date? If I don't hear back by like midweek next week, we'll just go with it. Would that be okay? Just to say hi to them. We missed you. It was a really good meeting. You're going to get a recording, you know, some of that. I'll put that date out there and see if there's any like strong, I can't make that, and we'll just pick by midweek next week.
Yeah, I think that would totally work.
Okay.
Sean is also going to send the follow-up with the recording and everything. Do you want her to include that in her message as well, or should we just rely on you for that part, Abby?
I think Shauna, when are you sending that?
I will probably pull all of this together midweek. I would say by Wednesday.
Okay. So let's not, I'll just follow up this afternoon and just say, we really missed you. You're going to be seeing an email from Shauna with the recording. And we did decide as a group for this date, is anyone not able to attend? And I'll just see what I get back.
Okay.
All right. That sounds good.
For those on the call then to hold that Friday. Okay.
Can I don't want to speak out of turn, but I do have a question for the group if when you guys have time.
Go for it.
So the National Family Resource Center or Family Support Network is holding their in-person member convening. So the leaders of the networks in each state basically are eligible to come to Washington, D.C. for their conference. Shauna and Mandy have experience with their conference. Mandy said it's really good, but it's a great way to connect with other leaders and find out kind of best practices and get to know each other. And there are also monthly member meetings, and we are part of the monthly member meeting invite, and we're also a part of the emerging market group, which is like an emerging network group for brand new startups, which there's probably 8 or so of us states that are in at the same spot we are in Alaska, like starting our network, and that's a really beneficial meeting. So Abby will represent us at those monthly member meetings, but if there's any other member of this leadership team that wants to be a part of that, certainly let me know, and we can Abby can ask the national network to include you on those invites, on the virtual invites for those meetings. But like I said, there's the in-person member convening conference in June in DC. I think it's June 19th and 20th or something like that week. And we have money from the legislator that we haven't spent yet on this network, and so I have gotten approval from OCS and the Child Welfare Academy to send a couple of our leaders to New York for the conference and pay for the expenses of travel and the conference. And Abby hopefully can attend. She's thinking she can go. And if someone else from this group who wants to be really involved in that and feels like that would be a beneficial trip, would you let Abby know of your interest in that? And then we can go forward. We might even be able to send 3 people. I'm not sure. It just depends on y'all's desire for that, but it really would be a great way to connect. And I can't tell you how valuable it is to talk to other network leaders who are doing this, because they're figuring out ways to get funding and develop processes, and they can tell us what's working and not. And so anyway, I just want to put that opportunity out there. We probably need to make some decisions more quickly than not about that, as June 19th is a pretty quick turnaround for getting all that stuff sorted. So reach out to Abby and I about that.
Do you know how long it is? Is it like a 3-day?
Sorry, you were
Conference?
cutting out. Emma, I don't think. Were you asking how long?
Do you? Yeah.
I think it's 3 days. I think. Let me look.
It was June 20th through the 22nd is what I saw. So I think it's a Wednesday, Thursday, Friday, if that's right.
Yeah, 20th through the 22nd, 3 days. Yeah.
And Emma, I think that, I mean, if we could have, you know, a tribal partner as part of that. You know, one of the things we're really pushing for, and I just did that request of Omni Institute, is we really want a lot of data, and we just want it to go out to the nation about what is happening with FRCs in Alaska tribal communities. And so your voice at a convening like that would be so important in my mind.
Yeah, and that is something that we're working on a lot just as part of the compact, but also with our organization, is just improving how we track data, because that's what people respond to, especially OCS. So that's kind of what we're working on. So I will throw my name in the hat, but there are other folks who have been around longer, and so you guys go ahead. I'll leave that decision to you. But Abby, will you be sending an email so that we'll have your contact information?
Yeah, I'll include, I was just thinking that I'll include all of you in my email to those that weren't here today, just so everyone has it. I don't want to assume everyone has my email, so I put it in the chat, but I'll follow up with an email as well. And yeah, Emma, let's go on a trip together.
And I don't think it's limited, like we, you know, if another
Time.
person wants to go, we might not, it doesn't need to be limited to 2, I don't think. I think we can figure this out. So if there are other people that really are passionate about going, certainly let us know.
Great. All right. Mandy, do you have any last words that you wanted to share?
No, just that we'll follow up with an email mid next week with the recording, and then we'll wait to hear from you, Abby, with the verified date for the next meeting. We'll send out materials from this meeting with that. Wanted to thank you all so much for your time today. I know it was a big chunk of your day, especially when a lot of you are already feeling overextended right now. And I know we're coming up on a weekend, so hopefully that'll be a reprieve. I didn't know if anybody had a chance to, maybe if we could just come off mute for a moment, and if you could just share maybe one word of how you're feeling after the meeting today. So I'll start with invigorated. I'm feeling invigorated from hearing about the excitement from all of you.
I'll go next. I feel inspired.
Say hopeful.
I'll say anxious. I mean, this is best practice. Like I can't express that enough. When I came up here and started doing this work, I was really hopeful that we would start seeing some of these things, because it is best practice, and that would be really helpful for our families.
And I'll add motivated. And I'm kind of sad that I don't get to potentially be a part of this committee. Dawn's going to be great, but I may just kind of, live vicariously through her, or show up every now and then.
I would use the word, did somebody say this already? The really energized for this group. I think you all can really get a lot done in a short amount of time in the structure that's already been established to move the network forward. It's really exciting.
I would say I feel supported by Shauna and Mandy and the Colorado folks and Patty. I feel like, somebody who's really going to help us get this done, who's been there, and that feels good.
Paul, did you have any thoughts?
Nothing that wasn't already said. I think hopeful is probably the term that's most strongly expresses what I'm feeling right now.
Great.
Well, thank you all. Look for communication from me about scheduling the next meeting and all of the follow-up from today, and reach out with questions before the next meeting if you have them, or reach out to Abby.
Thank you all for taking the time, and thank you, Shauna and Mandy.
Thank you. Enjoy the rest of your Friday.
Have a good weekend.
Bye, everyone.
Bye.